Yeah, good afternoon, everyone. So thanks for joining us for this webinar about e-clinics. And so we'll start with a presentation about the story, a little bit story about Jiyyo, and story about Jiyyo Mitra e-clinics, and what benefits does it offer to the society and to you if you choose to begin this, uh, and and then discuss maybe some questions, frequently asked questions about that. And after that, maybe Dr. Karthik might have something to say. And after that, we'll have a general discussion. On my screen right now. So I hope my screen is visible and my voice is clearly audible.
Yes.
Yes.
Yes, sir. Yes.
Awesome. Yes. So guys, so Jiyyo is a telehealth platform based in Chandigarh. This company is based in Chandigarh, and we hold this ambitious vision of having a hospital or an e-clinic in every village of India. There are about 6.5 lakh villages in India. And I'm sure you must agree, you'll be agreeing that almost none of them can, boast of a presence of a qualified doctor, either inside them or even, in a couple of kilometers distance. So now that telemedicine has arrived, okay, the government of India has extended its full support to it. Doctors associations like MCI, IMA have extended their full support to it. And COVID-19, although a sad situation, has also made everyone realize, every citizen as well as the doctors, that there can be situations where the doctor and patient cannot be in physical reach of each other, and yet they have to communicate. So telemedicine time seems to have arrived, and although for last 20 years, lot of institutions have been working on this thing. Primary institutions of India like NIMHANS in Bangalore, AIMS Delhi, PGI Chandigarh, Lucknow, they were and have been doing various levels of telemedicine over the years. So by no means it is a new technology. Of course, it is improving with time, but we believe that now is the time that it can be adopted, at each village level, at each personal level. So that is actually a big thing. So so that's how we think, and we have this mission. Ab har gaon mein hospital, as said in Hindi. In Telugu, I look forward to Dr. Karthik having its translation. And our English thing is every village deserves a hospital. So I'll quickly begin with Jiyyo's journey. So we began in June of 2017, and we had this great visualization of how the journey would look like: greenery on both sides, a great paved road. However, it frequently looked like this. Okay, so that's real life, but that made us more stronger with time. Technology became more smarter, and it helped us better understand what customers want, what are the actual issues faced by normal patients in various kind of cities, towns, and villages, and doctors as well. So obstacles are not always bad. Some frequently they are good as well. So, and that these things plus our basic mindset, make us believe that Jiyyo is research in motion. We do not think of ourselves as a typical business that we sell this thing and we make 30%, 20% profit on this thing. So that's not our typical way of thinking. we consider ourselves, a data analytics, experts and enthusiasts, rather than experts, enthusiasts more in healthcare. And we conduct a lot of experiments. We have done a lot of them, and we continue doing that. And some of the examples are we establish clinics, e-clinics in rural as well as urban areas. We operate about 135 of them right now. They are based in both villages and cities, though 80% of them are in villages, but of late, even cities are installing our e-clinics, creating a single specialty hospital to a multi-speciality, hospital or a clinic. So, so apart from e-clinics, we also, acknowledge that we live in a community, right? We are not a standalone person. So Jiyyo's platform has a lot of features and hooks to connect the e-clinic to its periphery uh, uh, through the platform. And we also experiment with and work with many other companies who provide AI-based population screening, health screening, for example, cardio screening or skin-related ailments screening or oral cancer screening, those things. Jiyyo's app is also employed in a clinical trial. We were approved for that a couple of months ago. And our system is used by ICMR and PGI Chandigarh, GMC Amritsar for various medical data collection aspects as well. So these are some of our mention in media and research circles. There's an article published in Journal of Postgraduate Medical Education and Research about how artificial intelligence can accelerate healthcare's benefits and access to it, co-authored by me and a professor in PGI. And then there was a coverage of Jiyyo patient referral system in Journal of Pediatric Critical Care, article published about 2 years ago. There is a Times of India coverage about the benefits of Jiyyo system in PGI. Then there is an article in Family Medicine Journal, many such things. So far, we are at 135 clinics established in 20 districts encompassing 6 states: Uttar Pradesh, Madhya Pradesh, Rajasthan, and Himachal, Punjab, and now Telangana as well. We have seen about 16,000 patients so far. It says 15, but the number has changed, 16,000. And we are happy to see that we see about 70% patient satisfaction rate. So we compute the satisfaction rate by having our telecallers call each patient, 2 days after he or she has taken the call and 7 days after that. So we do believe in very careful monitoring of our customers for their own benefit and ours as well, to figure out if there are any loopholes here and there. We have got about 300 doctors on the platform, hailing from cities like Chandigarh, Agra, Delhi, Hyderabad, for now Hyderabad, and Jaipur, Mathura, Mainpuri, Etawah, Jhansi, so bunch of these places. We have on-ground team present in 20 districts, and we plan to cover 60 additional districts in next 6 to 3 months. And we have multiple MOUs with Delhi Medical, with various doctor associations like Delhi Medical Association, IMA Rajasthan, Agra, Mathura, Panipat, a lot of such, work with doctor associations. And so this screen would show you how we take our take at rural e-clinics. So on the main screen, the main picture flyer here indicates our pitch. Every village deserves a hospital. Okay, and when we say hospital, we do mean a smart e-clinic. Okay, so hospitals are easily understood. It's an easily understood term in rural, than e-clinic. So, but in our e-clinic, we not only provide this video consultation with specialist doctors, qualified doctors, we also top that up by providing this sample collection facilities, medical devices for accurate and diagnosis like digital stethoscope, ECG machine, glucometer, pulse oximeter, bunch of these things. And then we have medicine availability thing as well. We try to hook the e-clinic operator with a nearby medical store. In your case, you guys all are pharmacists, so you may not need this thing. And then we also promote our e-clinic. We do not simply sell and vanish. No, if anyone opens an e-clinic with us, they become our friend and family forever. You can see on top right, there is a Sunil Kumar Shakya. He operates our e-clinic in Auraiya. It's a sample poster, how we promote him in his area. We hold e-camps as well and physical camps as well. So some pictures of how patients are benefiting from it. Some more pictures about our rural reach. We believe that we are probably one of the few startups who are entering India's rural segment, which comprises about 70% of India's population, which is huge, but very low, with very low penetration of advanced technology, and especially in healthcare. So we believe that we are one of the few startups who's doing this thing. So the future appears super bright. We are super excited, and daily we see amazing kind of patients from these villages, and which makes us very happy from a social impact as well. So yeah. So this is how our kit looks like right now. A 24-inch TV screen, Android box, a wireless printer to hand out the prescription to the patient, and other medical devices like I mentioned earlier. They can be purchased and used for better diagnosis as well. So I'll underline the digital stethoscope again here. We have integrated this to Jiyyo's platform, and that enables that a device can be put on the chest of the patient in the e-clinic, and the remote doctor can hear the sound of chest or respiration, heartbeat, etc. So that's amazing. That helps the patient diagnosis amazingly well. Some more pictures, on top right, middle, you can see in a decidedly rural setting, we have a LED screen installed, a printer installed, and the rural patient taking benefit of consultation with a city doctor. Then like how we promote an e-clinic in small towns, villages, cities. This is a list of some of the districts we are present in, and number of districts are increasing almost on a weekly basis. So it's amazing. Right. Pictures. This is a Manpuri district. Some there. So we are also in discussions of entering Odisha with some couple of organizations in Bhubaneswar. So that's working as well. In this picture, I'll show like how we promote through conventional means in the periphery. You might see a 7 feet by 10 feet this wall painting. So this shows up the full concept, just like Ambuja cement ads you might have seen on en route to village areas or semi-urban areas. So we do this kind of brand presence, and this also has helped us get a few e-clinics. So somebody traveling near this ad, they look at this and they say, "Oh man, this looks good. Why not?" Actually, if I'm running a clinic, or if I want to run a clinic, but I cannot hire so many doctors, and I don't know how to get them, then e-clinics actually is the surest bet to get the expertise of all kind of doctors in your e-clinics. That appears very straightforward conceptually. So, these are all some of the posters we provide to our operators, the doctors' names, photographs, and qualifications, if for better understanding of who these doctors are, in case patients are curious. So associating with us is straightforward. Just book an e-clinic online, or any other way. Receive a kit in a couple of weeks. A 30-minute training, install the kit in your premises, and boom, start helping the patients. So there's nothing, not much complication here. and we make available all doctors from all specialities available to you, and provide digital medical devices if you need them, tie-ups with pathology labs, medical stores if you have your own tie-ups, very good. If you don't, we are always there to help. Online medicine delivery. And lastly, we promote your e-clinic also. So if let's say you start an e-clinic, then your interest and our interests are aligned. So we work as a team. So I'll show you a couple of other things, like how we help our e-clinic operators establish their footprint in their area. So I'll go to that as well. Then about doctor fees, we have three kind of doctors: MBBS, rupees 150, patient fee, specialist 350, super specialist 550. And sometimes there is few percent up and down based on some special doctor who wants a higher fee or some specific fee. So we accommodate that. But these are the typical fees of our doctors. Patients can pay the e-clinic operator in any method they choose, while the operator pays to us through a Jiyyo wallet, the online Jiyyo wallet system, so online payments. Regarding monetary benefits, there are three revenue streams if you choose to operate an e-clinic. Average share in consultation is rupees 60. So for a consultation of MBBS, the operator gets rupees 50. For MD and a DM, specialist or super specialist, the operator gets rupees 75. So if you take an average, it comes around 60 rupees per consultation. Then rupees 60 for medicine sales and 60 for lab tests, typically. Okay, it could be higher as well for lab tests. Okay, and so on an average, rupees 180 can be made per patient, and at 4 patients per day, and an operating e-clinic for 25 days a month. So taking Sundays off and maybe another day off, about 18,000 rupees per month can be made from your existing premises. Okay, and so there is no rental cost, nothing. So once you start doing this thing, you just earn per patient. That's it. And so this is monetary gain. But now let's talk about something more. So operating successfully an e-clinic in your area also builds a name in your region. Okay, so we visualize and we encourage you to visualize Jiyyo as a healthcare network. Okay, where you are connected to specialist doctors or other qualified doctors, and patients are connected to you, right? And you may also be connected to pathology lab and medical stores, and maybe other e-clinic operators. It's kind of a network. So, a successfully run e-clinic can become a key local resource in that area to provide access to healthcare in multiple dimensions. For example, going forward, there could be, subscription, advanced health subscription plans, health insurance plans, right? Or, pregnant women, like, temporary ones, not the life insurance ones, child nurturing package, old people care package, bunch of these things. And the population screening thing, I mentioned a little bit earlier, that we are tying up with several, AI-based organizations who, provide kits or, software or app to screen for common diseases, in people, like skin problem, oral cancer, cardiology. So these technologies also become available to you, and in due course of time, health camps or general screening or working with local ASHA workers and others and hospitals as well can increase visibility, recognition, and eventually footfall to your e-clinic as well. And then there is a long-term career growth as well. You'll be able to build relations with top doctors, right? You're having conversations with them, so some sort of affinity relation can be built up, knowledge as well. You'll be in touch with new technology, right? Digital stethoscope, digital ECG machines, how that is being transmitted to doctors, how in real time their response is coming back. So this is also good technology and good processes to be aware, to be familiar with. And so yes, and we also frequently work with NGOs and CSR companies to conduct more research. So again, as I said earlier, we see Jiyyo as a research in motion. So projects with pharma companies on, let's say, impact of kind of a new medicine on diabetic patients, or PMS, post-marketing surveillance, projects with NGOs, a lot of things, and international collaborations as well. For example, we have been approached by a couple of doctors from Australia, cancer specialists. Now they say that for many years they want to talk to cancer patients in India directly, okay, and advise them some low cost techniques to handle their pain or their ailment. But for various reasons they are not able to, because right now I mean, that was their point, that healthcare is a little bit controlled by private hospitals here and there, and they kind of control certain things. So low cost techniques sometimes do not percolate down to the actual people. Okay, they're stopped at sometimes, not always. Stopped at. And also increase in reputation, and certain patients, can become repeat things as well going forward. And if you choose to, start an e-clinic, we provide a certificate as well that you are running this e-clinic from devices for testing. This is an example of a real-time consultation taking in the doctor prescription. A couple of screenshots from the app. You can see how straightforward it is. If you're referring a patient to a doctor, you can simply write its name and select doctor by just clicking, any doctor in the list in this grid, and simply hit consult button. The doctor will get a message, and within 15 minutes or so, the doctor will call back and a video call will start. Okay, sometimes audio as well, if that is, if the patient or doctor is okay with that. And in case you want to add more, vitals or reports, any x-rays, pictures of those things, so you can do them from advanced options. So all those things are there. Now this screen shows how digital stethoscope works. So once it is attached through Bluetooth with your mobile, then after putting the device on the chest of the patient, you can see the heartbeat like this, on your app, which can be shared with the doctor, and he or she can hear it and respond back. Now, how to start this thing? If anyone wants to open it, we first of all check if it is a rural area or an urban area. Basically, population density is what we check. In low dense regions, within 4 kilometers or 4 villages, we open one e-clinic. In high dense areas, we open one e-clinic in per 2 kilometer area. Rupees 5,000 to book an e-clinic in your location, and within 10 days or so, you pay the rest, and the full kit is installed in your premises. And then after that, we schedule wall paintings, the 7 feet by 10 feet, inside your clinic as well as outside for advertisement and better aesthetics also. After the sale, there is a customer care from 9 a.m. to 8 p.m. You can have chat with them anytime, any questions. Physical visits can be booked. Regular webinars where you get to talk to the doctors right away, for any kind of consultation, discussion, doubts, those things. And we do on-ground promotion and online promotion for e-clinic as well. There's a 1-year warranty. The future looks super bright. A telemedicine party has just started. COVID-19, although a sad situation, has acted as a catalyst. General awareness is also increasing, and so is technology. And government also seems very supportive. The cautions is also necessary, right? Patience is part of the game, and analysis paralysis, that kind of ruins a lot of initiatives. So we should guard us on that front. And my suggestion to anyone is that optimize returns for although in e-clinic the returns come pretty sooner. This is mostly for other healthcare startups, and there are some frequently asked questions. The most common question we get is it legal? Okay. Or do I need government clearance, some certificate from government, or some CMO should write that NOC, you know? So, our take on this is that this is 100% legal. Government of India has issued telemedicine practice guidelines on 25th March 2020. It's a 50-page document, and that legalizes it. And so you should go through it to understand, the actual details. But on top of it, running e-clinic is okay. PM Modi himself, encourages frequently business models based on telemedicine. Okay? And as an e-clinic operator, you work as a hospital manager. You do not provide consultations yourself. Qualified doctors do. Consultations have their name, and you do not take blood samples. The certified pathology labs, their representatives take the sample. So you only provide kind of center where these service providers can converge, right? So in a way, it's for a hospital manager position, there's no certificate needed. And since you are anyways pharmacist, so you do not need any thing on that. You're already good. So this is just a page on Gazette of India on telemedicine practice guidelines. PM Modi speaking on preventive and affordable healthcare to be provided at the village level. Then I'll request you to go through this tweet of PM Modi in the mid of April, where he's very happy that several consultations are always taking place without actually going to the e-clinic or hospital, and that is a positive sign. And he's encouraging that, can we think of business models to help further telemedicine across the world? So it's not just, India, the thinking is, across the world. So that's, we like that thinking, and we believe that, that is possible. Now, another question we get is, will I get patients to my e-clinic? Okay. So, we will work with you. Okay. And answer to that question, why not? Why will you not get patients? So, and long answer to that is, we will work with you. We provide, very tested and quality promotional support. We also support in social media ads around your e-clinic, 10-kilometer radius around your e-clinic. We run social media ads, putting your name, your address, your phone number, whatever you're comfortable with in that area. Pathology tie-up. And also, once we reach 50 e-clinics in a district, we also provide mobile lab availability, so that, for lab tests, people don't need to travel to further away. So we are open to this as well. So, and lastly, population screening, as I said earlier, skin disease, oral cancer, bunch of things. So when you do these things, visibility increases, trust increase, value addition increase, and which leads to better footfall. And this brings me to my last slide, which is again a common question. So, I like, and the question is, I like what all you say, and but I'm not sure. What should I do? I like doing it, but I don't know if it may work or it may not work. So there are typical responses that, unless we take a step, that's a practical point, right? In this world we live in, unless we take a step, we will never know if it is right or wrong. One, right? The second thing is, so not just in this regard, in any new venture or new initiative you do, you should always compute the cost benefit ratio. Now, what is the cost of taking this step, and what are the potential benefits, right? So that can give an objective understanding of the initiative. For example, in setting up an e-clinic, the cost is rupees 27,000 per, and about 2 to 4 hours of time investment, of which I think 40 minutes you have already spent. So, and 2 to 4 hours for training, understanding concept, those things. So these are the two costs, 27,000 rupees and 2 to 4 hours time investment. That's it. after that, the benefits are you get a new LED wireless printer and a shiny new e-clinic, which is not common right now. So it's kind of a leg up in that area. Then you get likely a new stream of revenue. Okay, how big that stream is, of course, it depends upon various factors. Okay, but definitely it is a stream. We are seeing we have already are seeing 135 such revenue streams in a specific regions. So and then you also get to see new technology, experience with it, and you get a chance to associate with top doctors, increase your experience profile, your confidence level, your social circle, right? So and your community as well, right? Even if 10 patients treated, man, they will always remember you that this was a clinic which gave me good treatment and a good doctor's advice. So I will encourage you to do this cost benefit objective analysis. So yeah, and I think that brings me to the end of my presentation. Maybe we can take questions later. Dr. Karthik?
Yeah, can you project the image I asked you
to? Hello.
Yeah, so we had a flyer, right, with Pharm managed the clinic and why Pharm. So if you can just project that, I anyways shared them with all of the students, but I just want to stress on few points.
You want me to share that?
Yeah, yes, the left one. So yeah, thanks for your presentation. So everything looks good for me, except the fact that in those 130 clinic, none of them are started by Pharm. So I would like to my students to just think and take up this initiative. So I and Siddharth are part of a group called Punjab Telemedicine Expert Committee. That is where I met him, and I shared a document. Means I introduced myself and also shared a document which says what is PharmD program and what PharmD graduates can do. So he looked into that document and he immediately sent me a message. Then we got on a call. I talked to him. He explained me this concept, and I thought this is really good, and this is what PharmD students are looking for. So then I said everything is same, but I only said the operator who runs the clinic will be a PharmD graduate instead of some other person who might not be as much qualified or competent as us. So I have listed out few points based on my interaction with lot of students on why our PharmD is a real fit in this situation. So first thing is do what you are trained for, the direct patient care, right? So this is what many students tell me. Most recently, one student was taking training in CDM. So after she attended 9 classes, she called me and said, "Sir, I think this is not what I'm supposed to do, and this is not my education has been for last 6 years." So I have heard such complaints from many students. So it does not mean you should not do other things, but this is really what we are trained to do. Okay. And everywhere, if you see, there is no scope, there is no employment. So here it gives an opportunity to create your own employment by setting your clinic, which is 100% legal. Okay, so where you will not be prescribing or doing some procedures on patients, you just connect them with the doctor, and then you do rest of things which a pharmacist is supposed to do. Okay, so and having clinic alone is one thing, but having pharmacy in the same premises will add more value to it. Okay, so you'll have two sources of income, and you can have your own pharmacy with all the things you talk, right? So how a pharmacy should run, you can implement and show it here. And one thing here, when Siddharth was talking, say patient comes to your clinic and you book an appointment with doctor, it takes around 15 minutes for doctor to get on call or on video. So this 15 minutes can be used by you to productively engage the patient in conversation and take their history, note everything down and find out what medications they are taking, the alternative medication, etc. So once you do that, you develop rapport with patient and definitely patient will like it. Let's say you are dressed up in a apron. Okay, you have a good ambience and you engage the patient with your conversation. I think he will think you as a doctor. I don't think he will even wait for a doctor to get on a call and consult, right? So once doctor gets on call, patient presents himself, but you can add. And I think doctor will definitely realize the difference between a pharmacy graduate presenting this case versus some other person who operates a clinic and presents this case to doctor. Okay. And then you facilitate consultation with expert doctors. I think there are already 300 doctors on Jiyyo's platform. And once, let us say, if we start such clinics in South, we will have more doctors who can understand patients' native language. So we already have 5 doctors who expressed interest to offer their services in Telangana region. All of them speak Telugu. Okay. So once consultation is done, this is where a PharmD can really pitch in. So you'll get a printed prescription through that wireless printer, and now it is all yours. Okay, so you can counsel the patient, educate the patient based on what doctor has written in that prescription. And if you're really confident, you can even audit that prescription and get back to doctor with, let us say, if you find some error or if you find some recommendations which can be done in while talking to doctor, right? And so here in Jiyyo, once the consultation is done, as Siddharth was taking after 2 days, their telecaller calls the patient and takes feedback. So I feel we can do a much better job there. So we can call the patient and maybe talk in great detail on whether he's taking his medication properly or not. Is he seeing any side effects? Or maybe you can even educate them on certain lifestyle modifications. Or you can stress upon all the points which you have educated when patient was in your clinic. So when you educate him, it does not mean he will remember everything and he will implement them. So once the patient goes home, you can follow them up. Okay. And yeah, so monitor the patient after consultation for better outcome. And if this better outcome can be documented, it can be published in good journals. And more importantly, it shows the value of a pharmacist in improving patient's outcome. Okay. So yeah, so don't miss out on this opportunity to put all your learning into practice. Show your skills in action, not just word. I think we have spoken for over a decade. I think 2008 PharmD started, and this is 2020. So it is, let us say 2014 first batch came out. So it is almost 6 or 7 years, and we are still speaking about our importance in words, not in real actions. So few people are doing it in few hospitals, but for it to revolutionize, it should definitely impact many more people, right? And according to me, this is one real good opportunity to integrate PharmD into Indian healthcare. So I envision to see this e-clinic, especially started by PharmD, being a center of healthcare. So patient comes to you, you connect them with doctors, okay? You connect them with labs, you connect them with pharmacy if you don't have your own pharmacy. And you also connect them with some people who can educate and counsel them. So this will be the center of healthcare ecosystem, and you will be the center connecting the patient with all other key stakeholders. So yeah, this is what I wanted to speak. Now we can take questions, and if you have any questions, Sophia, few has me on my WhatsApp, so you can ask now. Me and Siddharth can
Hi,
answer.
sir.
Yeah.
Hi, sir. Good afternoon.
Mm.
I have a set of doubts here.
Yeah.
So everything is fine here. Hope it works good. My doubt is, due to this COVID crisis, patients will support this e-clinic and surely it will work good. So my doubt is, once this crisis ends, will the patient support it? Will the patient support the same? And how to make the patients to believe this? And my second doubt is, should the person who starts e-clinic must tie up with doctors, labs, and pharmacies on his own, or will the company makes to collaborate with them?
So, Dr.
Siddharth, do you want to answer? Yeah, I think you can answer first, and later I will add my opinion.
So, yeah, thanks for the question. So, doctors will be provided by the platform, okay, and you can pick and choose, based on your preference, the Telugu speaking doctor or city based preference. So all specialities are available. So you don't need to worry on that front. You simply need to pick and choose. But your larger question was that during COVID, people might support it, but post COVID may not. So, so that may not. That is not the reality. We think that actually we believe that even if you take COVID outside of the equation, and then and if we try to think that okay, patients are everywhere, but qualified doctors are not present everywhere. Now, this statement holds true throughout the world. Actually, not just India. Even in US, if you look into the details, the cancer specialists, heart specialists, they are they are available only in few cities, not everywhere. And they are not produced in such a large number that every place or city might have. Forget villages. So even post COVID, in absence of such e-clinics, the rural patient has to travel to the city, right? So what we are trying to do is we want to reduce, that travel, that unnecessary travel. Yes, in some cases, the patient still needs to go to the city. We are okay with that. But the follow-up can still be done through the e-clinic, right? So that's why. And the COVID situation has created the awareness about this thing. So it has not created a new need. Temporarily it has, but more than that temporary need, it has made aware when such technologies are adoptable, and especially from the sides of doctors. So in the adoption of telemedicine, the biggest problem was resistance from the doctor side earlier. Not every doctor would resist, but some would, especially senior ones. But COVID has even kind of made them friendly towards this thing. So so we believe that actually these things are gonna stay forever, because of this line that patients are everywhere, but qualified doctors are not.
Thank
Did
you,
I
sir.
Hello.
Yeah. Yes, sir. Thank you.
So my take is, I think getting doctors is easy because we are connecting patients to doctor and doctor gets some kind of revenue. So I don't think any doctor will have an issue. And patients, will they really be interested? I feel it all depends on how well we can promote this and show the value. Okay, so if we can do this, I think patients will definitely start coming. Initially, it might be tough, but once patient gets better to the word of mouth and other things which we do, I think it should pick up. It all depends on how well we operate and not just start it and leave it, right? So as he was telling, conduct some camps, okay, conduct some awareness programs, etc., and make people know that they can get expert service instead of traveling to cities and spending a lot of money and time, etc. Okay, so it is the same with everything, right? Even if government allows us to do this, finally government will not push the patients to your clinic. It is we who have to show our value and start doing. Right?
And I would like to add one more point here, that try to think from the perspective of a patient in a town or a village who has this skin problem, who's not going away, okay, which is not going away. He has shown it to the local doctors, but the allergy or the problem is not going away. Now think from his perspective that if two options are presented in front of him, that one is you go to this local e-clinic and talk to the doctor sitting in the city, okay, right here, with a clear amount that you will pay this much and you will get to talk to this qualified doctor, which is an MD, very likely. And the other option is take a bus, okay, take an attendant, go there, and without knowing how much time will it take, when will the appointment be there, or would the doctor be present the time you reach his hospital, and which hospital to go in the first place, which dermatologist, what is a dermatologist. So all these questions are answered by an e-clinic for the patient, and a lot of money saving as well. The message has to go clearly, but we should ourselves be clear of all these immense benefits e-clinics can offer. Yeah. Thank you.
Hello, sir. Good afternoon.
Good afternoon.
Hello, sir. I have a doubt, sir. I want to ask that, like, I'm not talking about any specialty like MD or something. I'm talking about a general physician. So if we see in our rural areas, many doctors are already there who are whose consultation fees are much less than this. Like they are their consultation fees is like 50 rupees or 40 or 60 rupees. But if we open it like in 150 rupees, then there will be a like benefit for them only, no sir? Why the patient will come to us for this particular thing if they are getting it in much cheaper way in their own village or rural area?
So actually, I mean, you are right at the face of it, but probably we are comparing apples to oranges. Okay, so so of course, a patient who gets relief from visiting a doctor who takes rupees 50, he will never come to a clinic which is taking 150. Okay, that is clear. But do we think that that clinic is able to handle all the patients in that area? So we are talking only about those 70% patients which are not getting relief from the local treatment, and that's a huge percentage never computed officially. And to answer this thing another way, anecdotally, some of our e-clinics exist in the poorest areas where, and actually every village does have some kind of doctor available. Okay, he or she may not be highly qualified, but they are there. Even even in those places, we see patients' willingness to pay rupees 350 for a skin specialist, because he's being troubled by this skin allergy for last 2 years. Now he wants to pay less than 150, but he already probably has paid rupees 50 multiple times, but that hasn't helped. So we have to cater, we have to understand which market, which kind of patients we are targeting. Make sense?
Yeah,
But I
I don't know if any doctor takes 50 and 60 and practices. So far, I have not seen any. If he's a basic MBBS or MD qualified, they definitely charge more than that.
And yes, you should never compare fees of a MBBS to a doctor whose qualification is not known, right? So although we are tempted to, but we should not. Patient do sometimes, but awareness, that's where the awareness comes. And actually, one thing I like to say, that the moment a patient talks to a qualified doctor, he or she immediately understands what he is getting. So talking to a qualified doctor immediately dispels all the doubt. Man, this is a smart guy, he asked me right questions. So that also helps a lot.
Thank you, sir.
Hello, sir. I'm Aditya. Firstly, I would like to thank you for the excellent presentation. And my question is about how to deal with the medical legal case issues, like if something or anything goes wrong.
Yeah, thanks Aditya for the question. So under telemedicine practice guidelines issued by Government of India, a telehealth consultation is considered exactly same as a physical consultation, consultation in physical proximity. Okay, so same protection rules apply for the doctor as well as the patient. So the thing is, in a e-clinic, the prescription comes with the signature and the name of the doctor. So you are not should not be seen as the prescription provider, right? You are just the enabler of conversation between the doctor and the patient, and the regular rules apply for their conversation. One. Number two, we also have we also take patient's consent, before he or she takes a consultation. Okay, so that consent is agreed upon by the system, so that this offers additional defense going forward should something goes wrong. But even if that, the regular rules apply. It's and doctors are under protection on that. Yeah.
Okay. Thank you, sir.
Hello, sir.
Yes.
Hello, good afternoon, sir.
Yes, good afternoon.
First of all, thank you for the session, sir. Sir, my doubt is, sir, what about emergency conditions like poison, drinking or side accidents? If anything emergency means you cannot contact the doctor at that time, no, sir. So to deal with that conditions, such conditions, so what can the can we prescribe, or what is the alternative, sir?
So see, the thing here is, in an emergency situation, a patient should go to a real hospital. Okay, because some surgery, operation, or procedure might be required to be done. Okay, so telemedicine is not to handle emergency situations at all. Okay, now
Okay, sir.
there could be a practical scenario that in a village or a town there is no hospital accessible or open, now you can still, talk to a doctor, but that is only, in the absence of everything else. Okay, so that should be seen only as a help by the doctor, not the regular thingy. So for emergency, you should never use telemedicine.
Okay, sir.
Yeah, actually, I can add something here. So there are, I think most of you know Dr. Sai Princer, right? So he's heading Apollo's e-access, which is a teleconsultation program. So there, if patient has an emergency and if some early preventive thing can be done, so that will be done at a remote clinic. They stabilize the patient and then they get. So this buys them some time. Okay. So these kind of things can be done, but in general, telemedicine is not for the emergency conditions. But maybe the little first aid before the patient is presented to the main center can be done to increase the chances of survival. So that they are already doing, and I think my next one I will definitely schedule one with Sai Princer. Last week I attended one of his presentation, and they are handling some complicated cases also remotely based on the guidance from doctorate and higher center like Hyderabad. Okay. So that we can discuss, but in general, emergencies are not handled.
Okay, sir. Thank you, sir.
And actually, there is a difference between complicated case and emergency, right? Just
So other question is, how about internet connectivity in villages?
this is also a common question. So, our experience indicates, I personally, make this statement, on every platform I'm asked this question, that what internet I see in Chandigarh, okay, which is actually a pretty good urban area, is just about 10 or 15% better than what I see in the villages in Bundelkhand. So ever since Reliance Jio has come out with their towers across India, the mobile internet availability has improved amazingly well. Amazingly. It's not an incremental, improvement. It's amazing. Okay. It may not be perfect. Okay. So let's be clear. It may not be perfect, but it is great to help such initiatives. Not just help, uplift such initiatives. So it is great.
Yeah, I think internet issue is not a big issue now, because I see a lot of my relatives staying in village. They do TikTok videos, share WhatsApp status, and many other things. I think internet is good enough. And for such clinic to run, what bandwidth is required?
So 500 kbps, and anything higher, the video calling works perfectly.
Okay, so I think 500 kbps will be available at most of the villages. So So before sir, most of common people thinking will be like they get satisfied and trust when they physically meet the doctor than through telecommunication. So how can we convince this kind of thinking?
I think there, some sort of, advocacy and local promotion is needed to begin with. Okay.
Yes.
We see, I'll tell you, our first e-clinic in a very small town called Poonch in Uttar Pradesh district, Jalan. That person, told us in last year, August, that he's making 52,000 rupees per month. Actually, we were amazed and we did not believe him. We said that, okay, man, maybe you are over enthusiastic. It can't be so high. No, he's so smart that he has all the types with pathology labs. He has kept some small equipment with him also. Medicine is okay. So he gets a bulk share of, any additional prescription to a patient. And we saw this guy. He had this good convincing power. Okay, so that's actually needed. A patient needs to trust what you say. Okay, so it's not all about technology. It's about trust between two humans who are talking, right? If a patient who has an ailment, just understand his situation. He's in pain, right? He's not a normal person talking about some, entertainment thing. He's in some problem who's not going away. That's why he's sitting in your e-clinic. And if you realize that, man, this problem, will need speciality, doctor, there are two options. Either there is this bus stop in front of this road The bus will come in 40 minutes. It will take you to another town and take another bus from there. Then you go to city and take an auto rickshaw, meet the doctor, come back. And then take again the same, And also don't forget to take one attendant with you. That is option number one. It might cost you full day and maybe 400 rupees. The other option is that right now, man, I'll create your conversation with a top dermatologist. And the moment you talk to her or him, you'll realize that, man, he's way better than the town doctor I'm gonna, talk to in 4 hours from now. Take this small bet. Just talk to this doctor and realize. And actually, another thing I want to tell everyone, that we do give few consultations free, initially. It is 2 consultations right now. So these things increase trust, okay? Increase trust, and a good convincing power helps a lot when you yourself are convinced of the idea. So you yourself need to be convinced. And I'll tell you one small thing, that last year when we started, early last year, many people indicated to us that, man, this is NGO work. You are certainly not working for profit. This is who goes to villages. There is no money there. Now our vision kind of helped us. We said, no, man. We think that there's so many villages, something can be built here. And now we are actually enjoying some of the decisions we made based on our own conviction. So your conviction has to be there. You have to be the leader in this e-clinic. And if you make few such consultations, rest is history. One happy patient can bring 10 new patients. So
Yes,
confidence.
Yeah. So this is all about mindset, right? For example, just take me. Generally, I do workshops and I prefer doing in-person workshop because I can definitely create much more impact than doing it online. But now, anyway, situation is not going to improve. So I made up my mind. Finally, I was very stubborn that I will wait for the situation to end and start approaching colleges, go there physically and do. But nothing, I don't think for next maybe minimum 6 months, this is not going to happen. And I did an online workshop a couple of days back. So it took me some time to realize that even online it can be done well. So this kind of mindset change can happen. Now I think many people are realizing that they have unnecessarily wasted a lot of time traveling before COVID, which could have been easily done sitting at home. So I work for an office in Bangalore, the Health Cloud AI. So I used to go there every month, but now I am doing everything from Hyderabad, sitting at my home without having even to step out. So this is all about mindset, which will definitely change. But for all that to happen, we should take that initial first step and learn and then improve based on our learning. So I don't say everything will be great right from day one. So maybe we might not get any patients for say first 1 week or 10 days. Then we might figure out what might be the reasons, then come up with few strategies and then improve. Right?
Yeah. There are many questions, Dr. Karthik,
Yes.
in the chat. I just looked at them. How do we handle one by one or later, or what do you suggest?
So if you have time, I think we can take few questions now.
Sure. So
do you have time?
Yes. I have time. So I can start with Aditya's question. I think he asked.
Yeah, Aditya, we answered. I will read it out for you. So if patient contacts us, we investigated the problem, and if they need surgery, patient should go to real hospital, and all the fee and lab investigation and some of the tests or scan should be done again, because some of the hospital, they don't accept other reports. So patient think waste of time and money. How can we overcome? One more question.
So see, these things are handled on a case by case basis, right?
Yes, yeah.
So these are not things which happen every time. Right?
Exactly. So if you see say 10 patients or 50 patients, one patient might be like this. So I don't think we should spend a lot of time answering this. So this is rare. I think we should answer some common ones.
And I would simply add that even if this happens, maybe in 10% of times, then we should look into two things, right? As an operator, I think we and you should look into two things. That why are the reports rejected, right? Is the problem lying on the pathology lab which provided reports, or the hospital who want to promote their own pathology lab, right? So that needs to be understood. So without knowing that, answer to this question would be difficult.
So what about few physical examination that needs to be done for diagnosis like ortho and few neuro cases? So there, I think to some extent the equipment which Siddharth was talking will help. But if that patient really needs a physical consultation with a doctor, you will refer them. Okay, you will not manage it there.
You'll need to refer. Yes. And one more thing actually. So I think Janvi asked this question, right?
Yes.
Janvi and everyone else as well. So e-clinics also can play a great role in triaging,
Yes.
the problem. So this is about triaging. So many times the patient might come to you, and based on your knowledge and the primary consultation with even MBBS doctor, the patient can get a clear direction. Okay,
Yes.
I should do this thing. So even that triaging is very helpful to the patient. So let's look at the whole exercise from multiple angles. So unoptimized travel of a patient to a city is also very costly to the patient. Very, very costly. And optimized travel is still better.
Thank you, sir.
And actually, if you are really interested, we can see if we can do some training programs where the person who runs a clinic can be basically trained. I don't know how far it is legally permitted, but if it is, because I think Sai Pran sir will do it for a lot of nurses and people at remote clinics. They conduct some workshops or camps every month and train the person who operates that clinic to pick up few skills which he might not have. So we can do if you are really motivated.
Exactly.
Okay, sir. Thank you, sir.
And two more points here. As I said in my presentation in one of the slides, that this has just started. Telemedicine has just started. So many smarter equipments, devices, technologies will come and make such e-clinics even more smarter with time. So that's actually should be another motivation, that this is kind of being in touch with technology, the latest in the market, right? So
Okay, sir. Thank you, sir.
How much time it will take for one patient consultation from registration to video call? So I think it is 10 to 15 minutes.
Yep.
That is, whatever consultation needs a physical presence, that will be referred to higher center. Okay. For example, if patient does not have this option, for every condition he has to go there. But now once this option is there, he can come here first and then evaluate. If it really needs, he will go. Otherwise, he will not go. Okay. So this is not replacement for physical consultation. So I want to know about payment option, because in most rural areas, people may not have e-payment, so they can do in cash. Okay. But we meant to say even that option is available.
Okay,
cash
sir.
is
Thank
okay.
you.
Cash is acceptable.
So what about urban areas? How can patients be convinced to opt e-clinic, where every lane we can find a general physician? So in urban, I think if access is there, I don't know, maybe Siddharth can answer this. So our general target, at least of Jiyyo, is to have it in villages and suburban areas where there is not much access to quality care. But in cities, if it is already there, so one thing I learned is if that clinic only has a general physician, we can upgrade it by providing MD and DM support. Okay, so this is one way it can help the clinics in urban settings.
So I would like to jokingly answer this question that if every lane has a general physician, then even opening a regular clinic is not a good idea there. So
yeah, exactly. So how can we tie up?
Yeah.
Mm-hmm. So how can we tie up with pharmacy and lab? Pharmacists should not ask this question. So pharmacists should start their own pharmacy. That is my suggestion, because that will add more revenue. And labs you can definitely tie up. And anyways, lab will be interested. Once you have a clinic, I think even only they can come and approach you, because you will be referring patients to them and they can generate some revenue.
So, just one line here, that when you run an e-clinic, collaborating with doctors, labs and pharmacies is the easiest thing. So they'll do everything to work with you. So you don't need to worry about them. They'll come running after you.
Yeah. See, that is why I like this idea, because let us say you are appointed as a clinical pharmacist and you find an error with doctor's prescription. It will be difficult for you to convince. Means you can definitely convince, and I have done it in hundreds of cases. but the doctor has nothing to gain. But here, doctor will be getting to see few patients because of you. So then there will be easy collaboration. There will not be any conflict or resistance from them. Okay, and that is the easiest way. Is there any fixed time a clinician will speak? Will the charge be based on time taken? I think it will be just based on not the
Yes.
time he spends, but it will be for consultation. Let us say, even I mean, everywhere it is the same, right? For example, when first time I went to a doctor, he used to see outpatients for 2 hours, and he spent 1 hour seeing me, and he charged the same amount. So I don't think amount will vary based on time of consultation.
No, it does not. So far, it does not.
So does the e-clinic need to hire, rent out a space, or can it be done at home?
It can be done anywhere.
It can be done anywhere, but only thing I want to add here is if your home is in interior and if it is not really accessible, patients might not know. But if you are confident that you can pull them to your home, then you can start it anywhere.
The positioning.
Is there any such? Yeah.
Positioning matters. Yep.
Is there any such e-clinic in Tamil Nadu? So far, no. I think Jiyyo's presence is predominantly in North, and one guy is already starting to plan in Adilabad in Telangana. So we'll be really interested to take it to Tamil Nadu also.
So nothing in Tamil Nadu yet, but looking forward to it.
AP is going to start village clinics. What impact it will be showing on e-clinic? So I think AP government is planning to start around 10,000 such clinics. Okay, but I don't think this 10,000 clinics will cater to all the population in AP. And not just Jiyyo, there are other players also. There are a lot of NGOs doing it, but for a population like ours, we can have maybe 10 lakh more e-clinics and still have good number of patients coming to each clinic if it works well.
I'll have another take at this, question. So, see, as we mentioned earlier, the cost is 27,000 rupees, okay, of setting up this e-clinic, and there is no cost after that. It's only, you make some revenue, or in the worst case, zero revenue. So the worst case loss is 27,000 rupees, okay? But let's say we get a couple of patients, or let's say even one patient per day, we get to make some 7,000-8,000 rupees, a month or so, even higher actually. Now, talking about the government initiatives, okay? So government initiatives, are made for several reasons, and doing welfare is just one of them. There are many other reasons for making announcements. So my personal conviction is, by the time these 10,000 e-clinics start, you will anyways have made 3 times worth your investment in this e-clinic, and probably you might have a clientele already. Okay, so so that's how the government initiatives. There is a huge time difference between announcement and some movement on the ground. And given the investment is so little, you can already have your own clientele by that time.
So will Jiyyo have patient profile database so that follow-up can be made easily? I think this is doable. Okay.
Yeah. We do have.
It is easy to do.
Yep. We record everything.
And can Pharm 5th year start? Anybody can start, but you should have time to do it, right? So if you are 5th year and all your time goes to college, then who will manage the clinic there? So if you can balance the time, anybody can start it. You don't have to wait until Pharm is over. But generally, I recommend you to complete your degree and then start. What are the legal procedures to be done for starting an e-clinic? So I think Siddharth already spoke. So all you have to do is express interest and then start. I don't think there is any other legal thing. So I think we can close questions now.
Sure.
So what we have done is we have so far started 2 groups for students who expressed interest to know more. So I think this session has given you clarified a lot of your doubts. So my request will be, if you want to take this step and start, then I think we can have one more session with you. This is only for people who really want to start it. Okay. So you can remain in that group. Rest of them maybe can leave that group. So those who are very certain that they will definitely not start, they can leave. Those who are certain that they will definitely start, if not now, maybe in some time, they can stay back. Those who are uncertain, maybe not taken a decision and need little more time to think, even they can stay. Okay, so generally my intention is to get at least as many as possible, but to start with maybe 10 clinics started by PharmDs. And one thing I want to tell you, so Jiyyo has already started 135 clinics, and none of them are by PharmD. Most of them, I'm 100% sure, they are not as qualified or as competent as us. So if they can gather that courage and take a step, and why not we? Okay, and let me give you one example. So when I was maybe 1 year back, so, me and Nitesh, CEO of Health Cloud AI, we went to Kim's Hospital to learn history taking aspect from a doctor called Dr. Rakesh. So he was telling me an example of one contact he knows. That guy works as a driver in government setup, and every 15 days or every week he conducts a camp in his village where he understands the patient's problem, though he is not medically qualified. Out of his interest, he started doing that camps, and because he's announced that camp, and because uh, there is someone willing to listen to patient's problem, patients started coming to him, and with this little technology like WhatsApp or whatever, he used to take photos, etc., and capture some information, write it on a piece of paper, take a photo, and send it to doctor at Narkatpalli. So if a person who is not that qualified, out of his interest, can do this, why not we, after getting so much of training and knowledge and competency? So I think all of you are smart enough to convince a patient, engage with them, and do it. All it needs is just taking that initial step. Once you do that, I think within some time you can do much better than all the 135 other clinics. Okay. And when I uploaded this as my WhatsApp status, 2 or 3 doctors responded saying, we will be very happy if a person who is remotely running this clinic is a PharmD. So our rapport with them will be much better, and I think they can give us much more information compared to any other person starting a clinic. So everybody believes us except ourselves. Okay. So I think we should take that step uh, and see, and we will be happy to uh, help in every possible way. So I think this cost can be talked with Siddharth. I think he will be flexible to figure out better pricing for consultation. I think he will be flexible. We can try out few other things if 150, 350 and 550 is not very affordable. So I think they are definitely open to experiment and try with other numbers.
So yeah, I mean that can be looked into. The major portion of this, these consultation, they go to the doctor. So if doctors,
Yes.
if you find doctors who are willing to reduce it, yes, yep.
So actually, Dr. Navin, I think he told me that he is willing to offer his consultation free of cost. So once if doctor is willing to do that, we can reduce the price by
Sure.
easily 50%.
Yes.
Because majority of the fee goes to doctor. Clinic operator and Jiyyo shares only maybe 20% of it, but rest of it goes to the doctor.
Certainly, yeah. But that has to be provided consistently, because sometimes what happens is, it's tempting to offer free consultations, and people do that. But then if a consultation comes at an odd time, right? Let's say a doctor is taking rest or is talking to someone else, he may not probably take it seriously sometimes, right? So we have to be aware of the cost of the free item, right? Yeah.
Exactly.
Sure. And actually, just one point there. So rupees 550 for a DM doctor. DM is the super specialist, like a neurosurgeon, cardiologist. That's actually amazingly inexpensive. If a person goes to Hyderabad, you can maybe check yourself. Rupees 1,000 could be the minimum. For cardiologist consultations, and even higher. Endocrinologist. So these are actually relatively inexpensive. Okay, and they are for serious problems, so the patients would understand these things, but we are again willing to consider everything. Yeah.
Okay, so if anybody wants to just talk, share their feedback, we can do, and we can close. So no more messages in the chat. Any feedback on what you felt, or any other question to ask, you can unmute and talk.
Good afternoon, sir. The presentation was really inspiring, actually. I'm from Tamil Nadu. In Tamil Nadu, like many of the villages doesn't even have this primary healthcare. Even though they have, the lack of doctors is one of the primary concern there. I think this can compensate the place of such problems. I mean, the e-clinics. So, really, thank you for this wonderful presentation. And I mean, there is one request from my side. Please take it this e-clinic concepts to Tamil Nadu as soon as possible.
So if you are ready, you should be the first one to start clinic in Tamil Nadu. I think you can do a great job. So let me tell you, Siddharth, Gokul came to Hyderabad to attend an internship with me, and I tied up with an hospital and sent him there. So after he worked there, the hospital got really impressed, and they offered him to recruit him as a clinical pharmacist at their hospital. Okay, so this is the kind of impact he made. That hospital was earlier not having a PharmD graduate working with them. So we made few observations and we gave a presentation on how it can be done better with a PharmD. So if people like Gokul can do it, so ideally that is what I want. And all the people who are attending this session, I know them since some time, minimum say 2-3 years. All of them are really smart. So only thing is the initial step, if they take, they can do it very well. And once 10 or 15 such people start, automatically rest of them will follow. Okay, so initially my interest will be to get it started with some really good students.
Yep. No, actually, I'll tell you one point that, and thanks Gopal for the appreciation. So I'll tell you like a couple of anecdotes that earlier when we started in the Jalan district, we used to approach various doctors for opening e-clinics, and slowly it was catching up. And now there are in a couple of villages there's a dispute between two doctors that who will get the e-clinic there. There is so we show them WhatsApp chats. Okay, this person confirmed earlier than you, so sir, please this and that. So that also happens after some time. So people fighting to get the e-clinic, because every village cannot have more than one, right? So there's only limited number of options technically. Yeah.
Thank you, sir.
So Dr. Navin, I think, is also on call. Navin, you want to add something here?
Hello, am I audible?
Yeah, Navin. So I will introduce him. He recently finished MBBS and got seat in NIMS hospital for MD in radiology. He started it very recently. So for people who don't know NIMS, it is the #1 institute in Telangana. So earlier he got it in Usmania, but his interest was in NIMS, so he got it there. Yeah.
Yes, sir. Thanks for the introduction. So initially, actually, me and Karthik sir and Siddharth sir had a video call 15 days back. At that time, I was not sure about this because I was skeptical on who is going to start the clinic, who is going to the middle person. But after that, Karthik sir recently, 1 week back, posted a post saying that it should be a PharmD graduate who's going to be the middleman. At that point, I was going to actually send a message to Karthik sir saying that I will be on board if it's a PharmD student, because along with Nitesh, I work with Health Cloud AI. There are many PharmD interns. So I was really impressed with their knowledge, and I think they are the right persons to do this. So after Karthik sir told me that it's going to be PharmD students who are starting this, only after that I showed interest in this.
And anyways, all doctors like Navin know the blunders which RMPs and other people do,
yes.
And the complicated cases they see because of the wrong treatment which they give and take a lot of time. Yeah. So if a qualified person like us can do it, it will be beneficial at every level.
Yes, sir. Definitely PharmD students have edge over history taking and the prescription also. They can correct the minute mistakes which the doctors might make in the dosing and the intervals. So it's better to have someone who will take care of any minute mistake the doctors might make here and there. So it's like another set of supervision. So that was my thought. And second one is these telemedicine things are coming up very recently, and it's a change. So we don't know, it might be the normal thing in future. These clinics might not exist. So people might just log in on their computer and they directly connect to the doctor via the telemedicine or something. So it's a change. It's a futuristic aspect. So we never know what it might lead to. So it's better to invest some time,
So
money in it and see for yourself.
yes, yeah. So my final take is, even if pharmacists don't enter, so there are many unemployed youth who might take this opportunity, and finally we will end up crying that we lost this place to somebody who is not competent and qualified as us. So this can definitely happen. Okay, so I don't want others to occupy this place, and that is why I wanted to sincerely give a try and try to involve families here and see for say 2 or 3 months how many will be interested. If not, I think Jiyyo will open it for other people to get into this also. So at least Siddharth, I request you to give me a couple of months time before we offer it to other people. So I will give my best try to see if we can get foundation to this. If not, then we can open it to M-Pharm. And we also have one M-Pharm pharmacy practice guy here. So M-Pharm pharmacy practice is close to PharmD. So we can maybe offer it to others also.
Perfect. Perfect. Sure, man. Yep.
Okay, then I think Siddharth, we can close. Just once it is done, share the recording with me.
Sure.
I'll share to people who could not attend it live, and then we will see.
Perfect. Perfect.
Okay, so thanks for your time.
Sure. Maybe a couple of questions came up. You can handle them offline probably later.
Okay.
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 Cool. Thanks, everyone. Thanks, Dr. Karthik, for setting this up. Okay.
Yeah,
Awesome.
thanks.
Bye. Bye,
Thanks
guys.
all the participants. Bye.